Welcome to today's presentation. Welcome to our introduction to cardiomyopathy. So what exactly is cardiomyopathy? Well, it's a disease that affects the heart muscle itself. When this happens, the heart has a tougher time pumping blood effectively throughout the body. You might notice that the heart becomes enlarged, or the walls get thicker or even rigid. These changes can significantly impair its function. And why is that important? Because if left unchecked, cardiomyopathy can lead to serious complications like heart failure or irregular heart rhythms, known as arrhythmias. Understanding these key points is crucial as we explore more about how this disease impacts overall heart health and what can be done to manage it. Let's start by understanding what cardiomyopathy really is. According to the American Heart Association, it's considered a heterogeneous group of diseases that affect the myocardium, which is the heart muscle itself. The key point here is that these conditions usually involve abnormal changes like ventricular hypertrophy, meaning the walls of the heart become thickened, or dilatation, where the chambers expand abnormally. These changes are often inappropriate, meaning they don't serve a beneficial purpose and can impair the heart's function. Now, looking at it from another perspective, P. Hariprasad describes cardiomyopathy as a group of diseases that directly impact the structural and functional ability of the myocardium. Essentially, both definitions highlight that cardiomyopathy involves problems with the heart muscle's structure, how it looks and how it's built, and its ability to work properly. Connecting this to our overall theme, understanding these definitions helps us see that cardiomyopathy isn't just one disease, but a collection of conditions that compromise the heart's ability to pump blood effectively, which is crucial for maintaining overall cardiovascular health. Let's talk about the incidence of cardiomyopathy. It's actually the second most common direct cause of sudden death, with coronary artery disease taking the top spot. Now, when we look at dilated congestive cardiomyopathy specifically, about 5 to 8 per 100,000 Americans are affected. It's important to recognize that certain groups are at higher risk. Namely, males and Black individuals tend to be more affected by this condition. What's particularly striking is that nearly half of all sudden deaths in people aged 35 or younger are linked to cardiomyopathy. This really highlights how significant this condition can be, especially in younger populations. By understanding these key points, we can better appreciate the importance of early detection and targeted prevention strategies, which tie into the overall goal of reducing sudden cardiac deaths. Now, let's delve into the classification of cardiomyopathies. First, we have dilated cardiomyopathy, which is characterized by dilation of the ventricular chambers and systolic dysfunction. It often leads to heart failure symptoms due to weakened heart muscle. Next is hypertrophic cardiomyopathy, where the heart muscle becomes abnormally thickened, particularly affecting the septum, which can obstruct blood flow and cause arrhythmias. Then we come to restrictive cardiomyopathy, where the heart's walls become rigid, limiting its ability to fill properly during diastole, but without significant dilation or thickening. Following that is left ventricular noncompaction cardiomyopathy, a less common form where the myocardium has a spongy, non-compacted layer, often linked to heart failure and arrhythmias. Finally, we have arrhythmogenic right ventricular dysplasia, a condition involving fatty or fibrous tissue replacing right ventricular myocardium, leading to arrhythmias and potential sudden cardiac death. Understanding these classifications helps us grasp the diverse ways cardiomyopathies can affect cardiac function, which is essential for diagnosis and tailored treatment strategies. There are often multiple factors involved, including genetic predispositions, environmental influences, and lifestyle choices. For example, some conditions might be primarily genetic, meaning they run in families, while others might be triggered or worsened by external factors like stress, diet, or exposure to certain chemicals. Common features often include symptoms like fatigue, which many patients report early on. In addition, there may be neurological signs, such as weakness or numbness, reflecting nerve involvement. Skin changes are also notable, with some patients developing rashes or other dermatological issues that can serve as important clues. Gastrointestinal symptoms, like nausea or abdominal discomfort, might also be present, especially in more systemic cases. It's important to connect these manifestations to the overall theme of this presentation, which emphasizes the importance of recognizing early signs to improve outcomes. By understanding the range of clinical features, healthcare providers can better identify and treat this condition promptly. Let's now look at some of the key aspects of medical management for this condition. First, beta-adrenergic blockers, such as atenolol, metoprolol, and propranolol, are used to reduce the heart rate. By doing this, they decrease the workload on the myocardium, which can help improve overall heart function. Next, we have antidysrhythmic drugs like amiodarone, diltiazem, and lidocaine. These medications are essential for treating various types of arrhythmias, helping to restore and maintain a normal heart rhythm. Then, calcium channel blockers, such as verapamil and diltiazem, work by slowing down the entry of calcium into the heart cells. This reduces the contractility of the heart muscle, which can be beneficial in managing the workload and preventing episodes of excessive contraction. We also consider angiotensin II receptor blockers, including losartan, telmisartan, and valsartan. These drugs help by relaxing blood vessels and reducing blood pressure, which eases the strain on the heart. Diuretics like furosemide, torsemide, and spironolactone are used to manage fluid overload. Loop diuretics and potassium-sparing diuretics help reduce the volume of fluid in the body, alleviating symptoms related to congestion and edema. Beyond medication, there are non-pharmacological options as well. Atrioventricular packing, for example, involves packing devices that help regulate the heart's rhythm when necessary. Another surgical option is myectomy, which involves removing a portion of the thickened heart muscle to improve blood flow and reduce obstruction. Overall, these management strategies, medications, and procedures are aimed at reducing symptoms, improving heart function, and preventing complications. They are an integral part of the comprehensive approach to managing this condition effectively. Now, let's move on to surgical management, specifically focusing on the left ventricular assist device, or LVAD. This device plays a crucial role in supporting patients with severe heart failure. Essentially, it helps pump blood from the left ventricle to the rest of the body when the heart's own pumping ability is insufficient. It's often used as a bridge to transplant or as a long-term solution for those who aren't candidates for transplant. The LVAD is a sophisticated piece of technology that requires meticulous surgical placement, but can significantly improve quality of life and survival rates. Understanding its function and application is key in managing advanced heart failure effectively. Now, let's move on to discuss some of the advanced options for managing serious heart conditions. First, we have the implantable cardioverter defibrillator, or ICD. This device is implanted inside the body and is designed to monitor the heart's rhythm constantly. If it detects a dangerous arrhythmia, like ventricular tachycardia or fibrillation, it can deliver an electric shock to restore a normal heartbeat. It's a critical device for patients at high risk of sudden cardiac death. Next, we have heart transplantation, which is often considered when other treatments haven't been effective. This involves replacing a failing heart with a healthy donor heart. It's a complex process, requiring careful donor matching and lifelong management, but it can significantly improve quality of life and survival for suitable patients. Both of these options highlight how far we've come in cardiac care, moving from managing symptoms to potentially saving lives through technological and surgical advances. They're part of the broader theme of personalized, cutting-edge interventions that aim to improve outcomes for patients with severe heart disease. Now, let's talk about myectomy, which is a surgical procedure often used to treat hypertrophic cardiomyopathy. Essentially, it's about removing a portion of the thickened heart muscle, specifically in the septal area, to improve blood flow. This procedure is quite effective in relieving symptoms like shortness of breath, chest pain, and even some types of arrhythmias that patients might experience. It's a targeted approach that directly addresses the underlying issue of muscle hypertrophy. Importantly, myectomy isn't just about symptom relief. It can also significantly reduce the risk of sudden cardiac death in certain patients. Connecting this to the overall theme, it highlights how tailored, precise interventions can really make a difference in managing complex cardiac conditions. When performed by experienced surgeons, myectomy can improve quality of life and long-term outcomes, making it a vital option in our treatment arsenal. Let's talk about nursing management for this condition. First, it's crucial to ensure that all medications are taken regularly as prescribed, and to follow up with your healthcare provider as needed. A low-sodium diet is often recommended to help manage fluid retention and blood pressure. Drinking 6 to 8 glasses of water each day is important, unless fluids are restricted by your doctor. Maintaining a reasonable weight is key, and avoiding large meals can help reduce the strain on your heart. It's also best to steer clear of alcohol and caffeine, as these can impact your heart health. Heavy lifting should be avoided to prevent putting extra stress on your heart, and balancing activity with adequate rest is vital. In addition, using stress management techniques such as relaxation breathing or guided imagery can make a significant difference in how you feel. Always report any signs of heart failure to your healthcare provider. Things like weight gain, swelling, shortness of breath, or increased fatigue should never be ignored. Encouraging caregivers to learn CPR is also important because there's a potential for cardiac arrest.
Thank you so much for watching this video on cardiomyopathy. If you found it helpful, please give it a like and don't forget to subscribe to the channel. See you in the next video. Take care and stay